I stand before you not merely to speak about an important issue, but to ignite the fire within your hearts. It is a topic that doesn't get the attention it deserves, yet has the power to save lives, empower futures, and reshape destinies. So I urge you to please lend me your ears, hearts, and minds as we embark on this journey to discover how we can protect ourselves and our loved ones from this deadly disease, cervical cancer. But before we unpack this important topic, let me first tell you the story of a young dreamer, Aisha, whose aspirations were as vast as the horizon. Aisha was not just any student. She was a beacon of brilliance, graduating the top of her set from a neighborhood secondary school in Kefi, Nasarawa State. Her vision was to write her name in history as the first female governor of her state, and her determination led her to the prestigious halls of the Ahmadu Bello University in Zaria. Committed to learning everything she needed to achieve her dreams, Aisha was victorious, graduating with a first-class degree. She was on her path to greatness. She started an NGO which served as a vessel to navigate the turbulent waters of social and political activism. Aisha was a doer, a mover, and a relentless force to reckon with. Her future seemed limitless. But life took an unexpected turn in her mid-30s. She began experiencing a strange symptom, vaginal bleeding. This symptom lurked like an unwelcomed guest, casting a shadow on her path. She navigated from one primary health center to another, desperate for answers, until she reached the Federal Medical Center in Kefi. But by then, it was already too late. Aisha's condition had deteriorated beyond imagination and was barely recognizable. She had lost so much weight, was anemic, in severe pain, couldn't control her urine, was constipated, and had a terrible smell not even her loved ones could stand. She was thoroughly examined and investigated, and regrettably, a diagnosis of advanced cervical cancer was made, which had already spread to other parts of her body. Her courageous battle involved various surgeries, grueling treatments with chemotherapy and radiation, and an overwhelming financial burden that forced her family to sell their home. Tragically, Aisha's dreams remain unfulfilled as she succumbed to the merciless grip of this deadly disease. This sad story of Aisha is one too many, as every 2 minutes, a woman in this country dies from cervical cancer. And the most infuriating part of it all is that this heartbreaking tragedy can be averted in the first place. Now, let's understand the enemy we're up against. How many of you here know what the cervix is or where it is located? That is not surprising because a lot of people don't. The cervix is a part of the female reproductive system, simply referred to as the neck of the womb or the uterus, while cervical cancer is the abnormal growth of cervical cells. It is the fourth most common cancer globally in women and ranks number 2 in Nigeria. It is also the second most common cause of cancer-related deaths in this country. It is often caused by persistent infection with human papillomavirus, which is transmitted through sexual contact and targets women with multiple sexual partners, those that had early sexual initiation, smokers, those with a compromised immunity, those with family members with gynecological malignancies, amongst others. Moving to the most important aspect now, how do we then protect ourselves and our loved ones from this life-threatening adversary? The first and most important pillar of prevention is the human papillomavirus vaccine, which has been recently incorporated into the Nigerian vaccination schedule. This vaccine is the game changer in our battle against cervical cancer. It is given to young girls after the age of 9, meaning most of you here meet the criteria, and is most effective when administered before the onset of sexual contact. Just like other vaccines, it is very safe and works by conferring immunity against high-risk strains of this virus. The second pillar of prevention is regular screening with pap smears or HPV test. The pap smear is a screening test that detects early changes in the cervix before it becomes cancerous. The progression from these early changes to full-blown cancer is often slow and may take up to 10 to 20 years, giving an opportunity for early detection and timely treatment. While the HPV test detects HPV DNA in cervical cells. It is recommended that women begin screening for cervical cancer after the age of 21 by either having pap smears done every 3 years or the HPV test done every 5 years, or a combination of the two done every 5 years. These vaccines are readily available in most healthcare facilities, and the screening tests are very affordable when compared to the cost of treating cervical cancer. Like I earlier mentioned, the treatment for cervical cancer may involve various debulking surgeries, grueling treatments with chemotherapy and radiation, which unfortunately may not be available, are very expensive, and do not guarantee success, like in Aisha's case. This battle is also not confined to the physical and financial aspect alone, as it takes a toll on mental health, causing emotional distress, anxiety, and depression. It also has far-reaching impacts on social well-being, causing disruptions of friendships and family dynamics. So my question is, why is a cancer that is preventable still claiming so many lives? And the answer is simple: ignorance. And that is why awareness is our most potent weapon. We must spread the word about human papillomavirus vaccines and regular screenings with pap smears and HPV tests. We must commit to this noble cause, working together to ensure that our future is protected. Going back to Aisha's story, consider what might have happened if she had the HPV vaccine or had undergone her routine screening. Perhaps she might have been protected from this virus, or early changes in the cervix might have been detected in good time, allowing for timely treatment. Perhaps she might have gone on to realize her dreams as a trailblazing political leader, the governor of her state, and just maybe might have emerged as the first female president of this country. When I look into your faces, I see potential, I see dreams. I see the future. Let's protect that together. Remember that hope is not passive, but requires action. Therefore, we must take all the necessary steps required. Lastly, let Aisha's story inspire you not to fear, but to act, to live life with the knowledge that health is precious and vaccinations, early detection, and timely treatment can change the course of this disease. Let me leave you with the words of Helen Keller, which say, although the world is full of suffering, it is also full of overcoming it. Each of us here has the power to overcome, to make a difference, to dream, and ensure those dreams are within reach. Let us honor Aisha and countless others that have succumbed to the grip of this deadly disease by being advocates for health, for dreams, and for life. Here is to a world where cervical cancer is a distant memory. Thank you very much for listening to my TED Talk.